Good morning, student. How are you all? Okay, fine. Yesterday we discussed Unit 13, uh, perioperative nursing. Okay. The perioperative nursing, we will see organization and physical setup of the operation theater OT. We will discuss. Also, we will discuss yesterday classes essential requirement for OT, location, hospital, quantity, size of OT, design, how to design the OT, and we will also see yesterday classes equipments require. Okay, parameters of OT. We will see yesterday classes. Okay, and location within the hospital. We will see yesterday classes, and size of OT, quantity based on cost benefit consideration. We will discuss yesterday classes, and patient load and disease occurrence, ability of spaces we will discuss, and number of surgical bed, average length stay surgical patients. We all discussed this yesterday classes. Now today we will discuss classification of OT. Design also yesterday classes we will discuss major operative room, recovery room, sub-sterilized area, sterile instrument supply and storage, scrub area, clean up area, male dressing room, female dressing room, nurse station. These all we will discuss yesterday classes. So today we will discuss operation theater zone. How many zone in the operation theater? First zone is zone first, and zone second, and last one zone third. First zone first, the outer zone first, it is also called a outer zone, and zone second, it is also called middle and intermediate zone, and last one is zone inner. Okay, first we will discuss zone first. The outer zone, the zone is comparatively most of the unsterile zone. Okay, this all area is unsterile area, and this area is also known as intercharges area and arranged to avoid exposure to contaminated area. After this changing to the surgical garments, this area include changing the room like dressing room. Okay, like dressing room, patients, receptions, lockers, surgeons, and theater in the charge nurse. Who are the charges nurse will be there, and this all the area is a zone first. And office, conference room, classrooms, refreshment areas. For example, upon entry in this area, everyone include the patients and the surgical team should change into OT clothes and sleepers for their area. This is called zone first. Okay, we will also call this is outer zone and unsterile zone on non-restricted zone or interchanges areas. This zone avoid the exposure to contaminated area after changing to the surgical wearers. Next one is zone second. We will discuss zone second. It is also called middle या intermediate zone. This is the semi-restricted area. This all should be semi-restricted area. It should be in between the two zone. Okay, the two zone act as a transitions zone from zone first to zone second. This area should be large enough to receive supplies like linen, sterile supplies, drugs like IV, cannula, C-arm. This area includes recovery room and pre-anesthesia room, clean storage room, emergency needed sterile supplies. Some non-sterile procedure may also be conducted in this area. This area should not permitted personnel without OT room articles. Okay, this is also called middle intermediate zone and semi-restricted area. It should be in between the two zone. Already we will discuss. This should be large and receive the supply of for the surgery. And last zone is third zone, third. It is also called inner zone. Okay. Most sterile zone. It is also called restricted area and actual operating section on this OT. In this zone, rooms should be located and arranged in such a way this non-restricted area and non-related members are prevented from passing through the room. So this is maintain the sterile condition. We will say this this zone also include scrubbing areas. Okay, scrubbing areas and number of skin through elbow, foot control, tap. Okay, anesthesia room also and operating room. It is mandatory wear the scrub cloth, cap, mask and all the things we will be put on here. This last zone. Also this is compulsory to follow this zone suggestion because this all area is contaminated gradations of the OT. Okay, this is you understood. Or first zone first we will discuss, zone second and zone third. Zone first we will discuss the outer zone and second is middle zone and last one is inner zone या फिर most sterile zone. Next we will start the classification of the OT. There could be different criteria for the classification of OT. Okay, OT classification based on extent of surgery involved first. Second is types of service provided, which services we should be provided, and third one is sharing of OT, and last one is urgency situations. Okay, in on this basis of extent of surgery involved, OT can be discussed like major OT and minor OT. In minor OT, there are OT in which simple procedures such as stitching, dressing, casting, minor debridement may be performed. Okay, most of these operations under the location of anesthesia. Okay, minor OT we will discuss this all the simple procedures, stitching, suturing, dressing, casting. This all the procedure will be done in the minor OT. And next is this is major OT. This major OT, all the equipment with all the arrangement for general and spinal anesthesia required for the surgery. These extensive surgery involve deep tissue and perform here. Whenever any severe accident or major operation will be there, any in this surgical areas, the time major OT will be open. Next one is on the basis types of services provided, inpatient and outpatient, या फिर inpatient OT and outpatient OT. Okay, outpatient OT may be located in the outpatient department and involve the surgeries performed on outpatient basis. Usually they are minor surgery performed under the local anesthesia. Okay, next is inpatient OT. In this hospital area, usually we should use for inpatient, there are usually located any form of outpatient department. Okay, any outpatient 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 come for checkup, like for example one outpatient come in the OT for only dressing and after that he gone. Okay, the outpatient procedure require stay may be performed in a patient OT. Next one is sharing of OT या फिर on the basis of sharing of OT. It A and B, decentralized and centralized. Two zone will be there. Two sharing of OT will be there. Decentralized and centralized. And okay, decentralized, that mean there are several opening of theater. Okay, each dedicated to a particular surgical specialty of located near the specialty of department. For example, neurosurgery, orthopedic surgery, CTVS, cardiothoracic and vascular surgery. Next ENT. Next IOT, plastic OT. Plastic, whenever any plastic surgery will be there, it's done. Plastic OT, general surgery OT, gynae OT, renal and urology OT, transplantation OT, radiographic OT. These all are the decentralized OT. Next one is, we will discuss centralized. That what is the meaning of centralized? There is only the one OT complex in the entire hospital in one location. Got it? What centralized means? There is only one OT complex in the entire hospital in the location shared by the different surgical specialty. Okay. Next one is urgency situations. Urgency situation, on the basis of urgency situation, we will see emergency OT and elective OT. Okay, in the emergency OT, that there is concern with the surgeons and performed by the cases in emergency. These function all like the emergency, have ready this time, handle the surgery which perform urgently. These surgery are not usually planned and thus they not need prior list of patients to be operated. Okay. Next one is elective OT. You got it, emergency OT? Okay. Next we will start elective OT. In the elective OT, there are regular OT of hospital in which routine plan of surgeries and performed as per the list of patient decided at least 1 day prior to the surgery. You got it? 1 day prior to the surgery. It is it is decided ki which patient we will take over in this OT. Okay. Next we will see staffing of OT. Okay, staffing structure in the OT. First, the staffing can be measured in many ways. Okay. First one is number of hours and work. Most hospitals recorded the number of hours worked by the staff. Their hours are called productive hours. Okay, is called productive hours and excluded paid time off for the illness, vacation or continuity of the educations. Next one is hours associated with direct patient care. Direct patient care, how we will know it. Hours associated with direct patient care assignments. Some hospitals record the number of productive hours associated with direct patient care assignment, thus excluding nursing time spent in supervision role, care coordinator and other non-direct patient care activities. In all those the hours associated with the direct patient care. And next one is workload calculation. How to calculate the workload calculation. Workload in an OT may be calculated on the basis of number of the cases performed in 1 day, which generally depend on staff patient ratio. We will see what nurse patient, production of nurse hours and patient day into 24 hours. Okay, according to the Nurse to patient's ratio can be computerized from productive direct patient nursing hours in each patient day comprised with 24 hours. Okay, first like for example, nurse upon patient is equal to procedure nursing hours upon patient days into 24. We should calculate this formula. Okay, benefit of good staff. Next one is benefit of good staff. First one is improve patient outcome. When the patient improve the patient condition, patient disease condition, that time improve the patient outcome also. Next one is lower mortality rate. Yeah, maintain patient staff safety. Okay, maintain patient staff safety. And next one, lower mortality rate. Next one, increase the OT efficiency. Increase the OT efficiency. Okay, next one is reduce patient waiting time for surgery. Reduce patient waiting time for surgery. Okay, next one is balance workload of every staff. Next is maintain the staff accountability. Okay, maintain the staff accountability. Next one is OT staffing is based on first total number of hours in cases. Okay, total number of hours in cases. Next one is number of cases operated per day. How many cases will be confirmed with complete in one day. Next one, type of cases. It is short surgery effort. It is long surgery. Next one is nature of cases. Which type of cases will be performed. And next one is with prescribed norms and policy and procedure for this. Next is policy and procedure of an OT. What are the policies will be done? Every operation operation theatre should have clear-cut policy and procedure in written format. Okay, all the procedures should be complete in a written format. These are also called a standing out order guidelines. These all come from the standing out order of guidelines. These standing orders deal with first policies. Policy should be included the following. First one is function of OT, and second one is duties and responsibility of doctor and nurse technicians. Next, third one is checklist for the preparing OT for the surgery. Okay, next is posting of doctor, nurse, there are working hours and responsibility for emergency work. Whenever any emergency should be come the time, how many are posting or doctor, nurse will be working hours and responsibility of emergency work. And next one is maintain a record for the surgery. Okay, next is fifth point, method of aseptic techniques should be followed. It is very important point. Whenever we go to any surgery, the time we should first use the aseptic technique should be followed. Okay, next, maintain of sterility in different zone. Okay, it is also very important, maintain the sterility. Okay, disposal of waste management, it is also important point. Whenever we work in the hospital, the time how to dispose properly in the waste. Okay, next one is techniques of preparing for the surgery by nurse and doctors. Next, cleaning and operation theatre should be fumigating. Whenever we done any infected cases. Okay, that time after that done this infected cases, we fumigate the OT also, and every 15 days we should fumigate the OT. Maintain the equipment. All the equipment should be maintained in manner. Autoclave this all the articles. Okay, disposal of medical already it is done. Medical waste management, safety policies and procedures. Next one is staffing pattern. It is also a very important point. Staffing pattern in a OT. Okay, we will see first in whenever we staffing hierarchy in on OT should be shown in the chart given in the blue. Okay, first one is in OT in charge. Okay, first in OT, what is first one is OT in charge. Okay, after that operating staff, supportive staff and nursing staff. First OT in charge. Second operating staff, supportive staff and nursing staff. Operating staff, chief surgeon and supporting surgeon. Last one is finished. Okay, next one is supportive staff. There is supportive staff help for anesthetics and helpers and technicians. Next one is nursing staff. Nursing staff we will see first. Scrub nurse is important. Next is circulating nurse. And last one is procurement nurse. Okay, this all is the staffing hierarchy in a OT. Okay, next one is member of the team. Member of the team. First, effective work of OT require for the collaboration of various team members. The member of an OT team may be include first OT in charge, operating consultant, collaborating surgeons, scrub nurse, circulating nurse, anesthetics, percussionist, OT technicians, pre-recovery staffs, post-recovery staff, sterilization staff, storekeeper, helping staff. These all are the staffing pattern. Okay, the member of in OT can be divided into non-sterile team and the scrub team. Okay, this non-sterile team including the anesthetic, circulating nurse, pain therapist, physiotherapist, CPR team and assessing technician, other assessing technicians. In scrub of sterile teams involving team member directly perform and assessing the surgery such as operating surgeon and other scrub nurse. Next one is before we start role of nurse, we will discuss teamwork in a OT. How to done the staff our work. Okay, a protective operation theater aims to improve the outcome of efficiency and motivate the staff. It is very important कि we motivate our staff. Okay, motivate our staff. Required for optimizing team working among the staff, raising the standardized care of and reducing the operational delays. Okay, this teamwork can be considered as one of the mandatory essential or efficiency of OT work. First one is essential of working and collaboration in a OT team. First, the operating team should be good interpersonal relationship. Whenever we do any teamwork, then in between the teamwork we should maintain the good relationship each other, good interpersonal professional relationship. Okay, I use They are one word, professional relationship only. Okay, the operating team should have good interpersonal professional relationship. Second one is any new members entering the team should be oriented to the rest of team and opportunity for communicate and build the IPR, interpersonal relation should be improved. Okay, it is very important point. Whenever you also done any work, the time you remember this all point. Okay, next one is all the team members should gather together for beneficial session before start and end of each day surgery. Okay, next point, provision of refreshment terms. Whenever provision and refreshment time would help in making the team dynamic and working stronger. The use of WHO, World Health Organization, safe surgery checklist and also important way to monitoring communication skill. It is also very important point कि we maintain the communications. Okay, next is important means improve the communication with an OT member. It is advisable place such as board and center area that staff is aware of the OT day processing. Whenever procedure will be in a day, we all know what is the done today. Okay, a collaboration between the pre-OT staff and post-OT staff should be maintained. The helping of smooth transaction patients with their areas. Okay, improve the team working and collaboration in OT team, reduce the OT adverse event, infection rate and other complications. And whenever we done any work in team and take responsibility for every work, the time reduce the infection rate and other complications. Okay, these all are the teamwork in a OT. Understood all this? Next is role of nurse in a OT. Okay, it is very important. Nurse are the primary force of operations and surgery. Okay, there are very specialization, orthopedic, orthopharmacology, obstetrics and cardiacs, all the require operating. They all are the operating teams because the nature of their nurse be job very complicated. Okay, nurse play the multiple role before, during and even after the operations. We have two types of major roles. There are scrub nurse and circulatory nurse. First one, scrub nurse. Scrub nurse, a pre-operative check for the availability of the material for the surgery. Next, psychological preparation of the patients. Next, follow correct aseptic techniques. Okay, positioning of the patients. Okay, in all those points, first we will discuss scrub nurse. What is scrub nurse? Scrub nurse should be maintain two things. One is the patient and other one is the equipment. The scrub nurse also expected to pass the equipment to the surgeon as request. They may be seen like as easy to take, but it should be very knowledgeable, and every single pieces of equipment should never mistake one of another. True, they would not be using equipment themselves. Their nurse should be also known know the use of each pieces of equipment, which will help the team respond calmly and immediate to the surgeon request equipment, which will be help to team response and calmly immediately to the surgeon request. Whenever surgeons would be ask for any equipment, the time you should give quickly. And response, it should always be alert in a case of surgeon ask for something. It is also a scrub nurse responsibility to account for all the pieces of equipment, especially after the operations. Okay, proper administration of medications, delivery of high quality patients care, nursing care based on EVP, and participate in risk of assessment and reporting, assess the plan, implement and evaluation. Next one, maintaining of resources. Next is organize any priority of workload, support other staff and maintain the health. Okay, and other key responsibility of nurses, you all know, aside from of scrub nurse, in their nurse can also be called circulatory nurse. The main responsibility of circulatory nurse is to open the pack and need to be used. Most of time the pack of need to be open, contained and sensitive content, that should be remain the sterile. Okay, the circulatory nurse should be sure that the operation room is not be contaminated in any way. Okay, and other role of these all these, first, a operation theater nurse can also handle the anesthetics duties. Okay, aside from that, the their nurse responsibility for the well-being of the surgical patient. That is when the nurse take an outpatient recovery or ward role. A patient who is undergone the surgery, the time operation have different need of the ordinary patients, and therefore the nurse have checked the patient just undergo surgery. The patient BP should be the nurse know the BP of patient, all the vitals will be known through the nurse. They are also trained to provide the post-operative consultant, because they will be one of who will maintain the close contact with the patient during the recovery. Okay, and other responsibility, you all know, ensure the pre-operative checkup, made the accepting whenever department of prior administration, anesthesia, surgical procedure. Okay, this all, you know, support and other maintaining health, safety, security, correctly follow and routine, maintain the schedule procedures, maintain the resources of efficiency and effectivity. These all are the responsibilities of nurse. Okay, to be continued tomorrow lecture. Okay, got it? If you have any doubt, you ask me. Okay, student. Thank you.